woman, if they think back to their own children and how their births went, how difficult it was, imagine being alone. Imagine no one being with you, or somebody being there that really didn't know anything about birth except that it happens and that they'll push on your stomach to get the baby out. Imagine if you never had the chance to have a cesarean section, and if you did, you were thrown into the back of a truck and had to ride 4 hours on a bumpy road all by yourself to get to a hospital where you don't know if the doctor's going to be there or not. I'm Dana Allison. I'm the founder of Women's World Health Initiative. Women's World Health Initiative is a nonprofit that builds sustainable healthcare systems focused on maternal and child health. My mother tells the story when I was 5 years old, and there were the Ethiopian famines going on, and lots of videos with little children and flies on them and puffed bellies, and I was crying and saying, "What can I do to help?" And she said, "Whatever you can." I decided that from that day forward that I would not tolerate people suffering in such a way without doing anything. Eventually, my career led me to work with the United Nations High Commission for Refugees, and I worked in a refugee community in the maternity clinic, and I had never witnessed that kind of daily suffering before. I really noticed the difference when a mother died during childbirth, that it affected her entire community. If the mother is present, a girl's education increases. If a mother is present and healthy, the health and welfare of the family increases. So that is when I decided that the first thing that I need to do was to keep the mother there, healthy and strong. So I started researching other organizations that focused on maternal health, and there are many of them, and there are good ones. And I just didn't find an organization that I could hold on to. What I saw from my experience was once they left that area, if they ever did, so did everything that they tried. So I recognized that we had to work from the inside out, not from the outside in. 99% of all mothers' deaths happen in the developing world. These poor women deliver their babies primarily in the hut, sometimes by themselves, with no help, no encouragement, no doctor, no hospital, no nothing. And so many women postpartum get infections because they're on a dirty floor, and there's no follow-up. There's no one to come check a simple infection. We're talking something that is so easily treatable with $2 worth of antibiotics if somebody would just look in on them and know what they were looking at. But instead, the woman suffers till she's almost dead. Dr. Youssou N'Doye, who is a strong health advocate in Senegal, in the most remote rural area of the country, he and I started to work together to develop the most feasible and effective program. We've been developing our relationships and doing needs assessments to really know the area and to gain really strong governmental and individual relationships with the people there, so that we didn't just come in a big hurry and started to do whatever we wanted to do. But these people know us and we know them. We in Women's World Health Initiative are working with the people in these areas that have these very problems and where these women have so little hope of having a healthy, safe birth. We are helping, training, educating the very people who can sit by their side, who can hold their hand, who can assess their birth, who can follow up after the birth. Our current focus with Women's World Health Initiative right now is to decrease malaria infections and the level of anemia for these women, which are both deadly during pregnancy. So by preventing, by surveying the pregnant women, by treating them directly when we find malaria, they'll have a much better chance of surviving. I have a hope that people will see the validity of working from the inside out instead of the outside in. I hope that people will see that every community in the world has an opportunity to change and to strive and to become better, and that with very few resources from the outside, the change on the inside will be extraordinary to them. Women's World Health Initiative is focused and is concerned only with the right of that mother, and we will sustain her, defend her right to be healthy, to be strong, and to really enjoy that moment of bringing a life into this world.